Hi, I'm Karen Collins. I'm talking today with Dr. Susan Stack, who's a registered dietitian and associate professor of epidemiology and biostatistics at the University of South Carolina in Columbia. Much of her work involves the intersection of inflammation and chronic diseases like cardiovascular disease and cancer. So it's a really hot topic and something that I know many people want to know more about. Thank you so much for being with me here today.
Thank you for having me.
It. Yeah. So this topic of inflammation, there's a lot of, it's everywhere, everybody's talking about it, but I'm not sure everybody really understands this chronic low-grade inflammation. Can you fill us in a little bit about that?
Sure. So, as you know, inflammation is a normal biologic process. It usually occurs in response to an injury, an acute injury, and so inflammation is needed for wound healing. Inflammation response helps that immune response to heal the wound, and then as soon as the wound is healed, it subsides, usually. But as you mentioned, there can be a state of chronic low-grade inflammation that exists for a variety of reasons, perhaps due to environmental exposures. Obesity is associated with chronic low-grade inflammation, a poor diet, lack of physical activity, lack of physical fitness. Those things are all associated with this chronic low-grade inflammation. And that type of chronic inflammation has been associated with a variety of chronic diseases like diabetes, cancer, heart disease, and so forth.
Yeah. And now there are a number of different ways you can actually measure this.
Right.
So that's an important piece for people to understand. It's not a sort of made-up thing.
Right.
You can actually measure and document where someone is, and that's how you've established these ties to disease, right?
That's correct. So you can take a blood sample and measure things like C-reactive protein, CRP.
Okay.
That is an indicator of inflammation. Now, that's going to increase with an acute injury as well, but it also can be a measure of chronic inflammation, and the American Heart Association, in fact, has a cut point of 3 milligrams per liter of CRP, and above that is considered an increased risk for heart disease. And there's other markers as well. So there's cytokines like interleukin-6, and then some of the other interleukins. TNF-alpha is another one that can be measured. And these are things that we've measured in some of our studies, looking at diet and inflammation.
So if someone has these elevated markers of indicating a chronic low-grade inflammation, is there evidence that that can change, or once it's elevated, is that they're stuck with that?
No, it definitely can change. So certainly the use of non-steroidal anti-inflammatory drugs like aspirin can have an effect on that, but not everyone can take aspirin safely, and some of these other NSAIDs have adverse events or adverse side effects. So diet in particular has been shown to be able to reduce CRP in particular, with some of the other inflammatory markers, and being more physically fit can reduce those as well.
Now, sometimes people think of exercise as being promoting inflammation. They're afraid of that, but you're saying actually it's not, right?
Well, so it's an interesting dilemma in epidemiology or in science, right? So it's something like physical activity or even, consuming hot peppers, for example, right? That has an acute increase in inflammation, but over time, as your body adjusts to being more physically fit, to being more physically active, it actually has the effect of reducing that chronic inflammation, that risk of chronic inflammation.
So you shouldn't let that fear deter
Right.
you. It should actually view it as a positive. I will tell you that if I Google searched anti-inflammatory diets or searched on books, there's a ton of them out there.
That's right.
How do I make sense out of it? Because the general gist of it, I think, tends to be similar. But, for example, there was a study where they actually took a book that was supposedly based on that, and guess what? It didn't actually associate with CRP levels. So how do I make sense out of all this information? What do we really know, and what is not worth acting on?
Right. So there is another inflammation factor rating system that exists, and I know the book you're talking about, and it does rate specific foods. But for example, with that one, some of the fruits have a pro-inflammatory score. Things like bacon and processed meats actually have an anti-inflammatory score if you look at their score. And so I think some of that might be driven by the glycemic index is included in that anti-inflammatory factor rating system, we did not include the glycemic index in our dietary inflammatory indexes. Straight nutrients and food components. And so, the protein content of certain foods may affect the glycemic index, and that would, perhaps explain why some of the foods that we might tend to think of as probably not being anti-inflammatory ended up on the anti-inflammatory side of that scoring system. So I think that the benefit of our dietary inflammatory index is that it is truly evidence-based. It's based on the literature, and it's one of the few indices out there that is just based on the evidence and based on scientific publications. A lot of the diet scores that we see are based on guidelines or based on a certain food pattern, like a Mediterranean diet or something. But I think what we're seeing is that there are many ways to eat an anti-inflammatory diet. It doesn't have to be just one type of cultural diet or based on one kind of food guideline or set of standards. There are many ways to eat an anti-inflammatory diet, and I think that's the main message to get across. Of course, a plant-based diet, fruits and vegetables, whole grains, that's going to improve that dietary.
That's kind of the consistent
score.
thread,
It is,
right?
right. And less red meat, less processed foods. That will certainly help to keep that score more towards anti-inflammatory.
So the bottom line is, just because a food or a book or an article or whatever says anti-inflammatory, it's not always truly evidence-based.
Right.
So look at the source of these recommendations or advice that you're reading and hearing about. It's not all the same.
Right.